What happened?
My name is Matt Sirianni. I was a professional baseball player for 13 years with 3 different major league organizations: Milwaukee, Arizona, Cleveland. Played for the Italian national team for 2 separate years, as well as Team USA. I was injured in a collision accident in 2007 in May. And I had a collision where I went straight forward and in essence speared the catcher in a collision at home plate. Put my C2 out quite a bit, quarter inch, maybe more. I went to the chiropractor during that season. He couldn't even work on me for more than 3 weeks. It was so tight. Long story short, it pretty much, next 4 years I played injured and hurt with an impingement on my left side. And after that happened, I ended up having to have shoulder surgery in 2012, 2011, 2012. I think about 2010, 11, right at Christmas time.
Do you think that surgery was really your neck pain that was causing the shoulder pain, or was that a different issue?
I think that was definitely the main portion of it. I did have 2 very big spurs because of the impact injury, as well as the constant impact from, I was a catcher for all those years, and my left hand took a lot of the brunt of the impact. So there was a few things going on, but the main thing was the neck, mid-thoracic, upper cervical, both very, very painful. Couldn't sleep, haven't been able to sleep for the better part of 5 or 6 years.
Were you seen by numbers of doctors and numbers of practitioners over those 6 years?
I saw a chiropractor and I saw a practitioner, and then I saw 2 separate doctors who were both orthopedists. One was, both of them were out of the Bay Area. You know, both were sports doctors. One worked with Cal Rugby, one worked with USA Track. I ended up getting the shoulder surgery. They shaved down the humerus head. That was done. But at 36 years old, I still can play, and my body's in shape, other than my neck. I saw Dr. O'Connor in, I believe it was June of this summer, 2013, and we basically went together, and he showed me a technique that allows the nucleus pulposus to be moved in between my vertebrae, which was the cause of my pain. You know, even after the surgery, I rehabbed it for almost 2 years. And would still run and slide in pickup baseball games. And sliding, I would feel pain in the back of my neck. So we got together, worked on it. He showed me a technique that saved my life, saved my career, saved my agony. The pain that I've been in was instantly gone the moment, I want to say 5 seconds after I stood up and did the last part of the technique. My neck pain, which I had had since 2007, 6 years approximately, was gone. Instantly gone. My mid-back pain, we also worked to move that in, and that vertebrae also moved in with the proper amount of traction and time and sweat. It's definitely some effort on my part, and it was well worth every minute of it. Now I'm considering, after only having had the technique done, missing 2 years, playing 4 years hurt, I can legitimately tell you that I have an opportunity to go back and play in Major League Baseball and get an opportunity to sign in the minor leagues and give it a shot.
Prior to meeting me and reading my materials and having me explain what the source of your pain was, had anyone prior given you better an understanding of what was wrong with your neck and your back than my technique and myself?
No, not at all. Matter of fact, I didn't ever have any doctor that I talked to who properly diagnosed it at all. Shy of a chiropractor, which I, necessarily don't do regularly. It's more of that's something that happens when I'm in constant pain, where I can barely drive or walk, etc.
And so
no
one really could tell you what was wrong with you.
No.
Now,
no.
I told you what was wrong with you, even without an MRI.
Correct.
I mean, I didn't have to see an MRI to do that. I did my test, the diagnostic circumduction on you, and told you what was wrong with you.
Right.
Are you convinced that I know what I'm talking about, and that that other people with similar problems who have a range of motion problem and chronic pain, now that you know how simple an understanding it is, do you think it applies to the bulk of other people out there?
It applies to anybody that has a back or neck problem. Absolutely, 100% positive. There's no doubt in my mind. This technique works for anyone that can try it, that has the ability to sit in a traction position and do the technique. I would recommend it to everyone, especially athletes, people that are looking to avoid surgery or have a turnaround where a normal low back injury, mid back injury might take 2 to 3 weeks. Instantly, this was better. My low back. And also the technique is something you can do on your own. Dr. O'Connor taught me how to do it by myself, and I, have had a history obviously with this back problem of having trouble sleeping. So at night, I've actually turned over wrong and put my own back out. Well, with this technique, I was out of state and did it myself on a couch. So you can really effortlessly, by yourself, with the proper understanding and the right technique, fix your own back.
And it's a mechanical problem, and my solution is a mechanical solution. No hocus pocus, no injections,
right.
No surgery,
exactly.
No nothing.
And it's not easy. It's not something that you can sit here and have a conversation while you're doing it. Absolutely not. This is something that you have to focus on. You have to listen to instructions, and you have to do what is needed. And when I did that, my back and neck separately all went back in place.
But the concept isn't terribly complicated, is it? It's actually quite simple. Aren't you kind of amazed that no one else figured it out?
I'm very surprised.
And that they didn't properly diagnose you?
I'm surprised that in the medical field, me having a slight medical background from college in physiology and knowing that things that happen to you in a physical sense, collision, injury, can be fixed. Knowing that, and knowing that I've been a world-class athlete my whole life, and others like me who also have been injured and rehabilitated and have constant chronic pain. I also know that for these people, even though they've been hurt for more than 5, 6, 7 years, it can still help. I've been hurt for 6 years, and my career was over, is over, until now. And now I really legitimately I've got a fire back, I've got more energy in my body, I sleep well.
Without the pain, the constant
and the pain is gone. And the pain is gone. Yeah, basically.
It's amazing how pain
it happened
does that.
Instantly. The moment we did it, it was gone. The traction exercise took about 15 minutes, but it's a combination of relaxing and movements, and it makes perfect sense from my background in physiology. It really made sense, and it works.
And you wouldn't mind if I put this on the internet?
Please
and let
tell
other
everyone.
people?
Everyone should know about this. This is not something that is something that Dr. O'Connor is doing for the greater good of the world, people, human beings in general, so that you can help yourself. For me, one of the reasons that I could not get to a doctor in time was the financial burden. And to be honest with you, now that I found Dr. O'Connor, it would be worth taking a second job to have this knowledge. The knowledge to me is more important than anything that I've been through, drugs, surgeries, techniques, stretching, all these other things. I've done them all. And the only thing that happened differently was that it fixed it. It fixed it instantly, and it fixed it, and it hasn't gone back out.
Yeah.
It stayed in. And now there are, if you continue to do things incorrectly, physiologically, you can easily put it back out. It's same as a car accident, same as a collision injury. When my doctor saw me after my injury, he said it looked like I was in a car accident at 65 miles an hour. Lived with that for 6.5 years. And it went back in one day, and I didn't have pain ever.
Had you read my literature at all on the internet?
Not before we worked together, no.
No, I mean afterwards.
Oh, yes, definitely.
Is it outside the realm of reality to expect someone reading that literature to understand those concepts and apply them just by videos and reading and whatnot? That the same thing could happen to them?
I don't see why anybody who doesn't know how to take directions as far as, if you can take directions in working out or tying your shoes or putting clothes on or doing anything, this is that simple.
Yeah.
It's not a difficult procedure. You do need to be with somebody the first time that knows how to do it. It's not something you can maybe necessarily do on your own the first time, but after having it done to you once, you can do it.
Someone with your degree of problem, I would recommend that.
I have a little bit more than a basic understanding. Yeah. But even with that said, people that just do have a basic understanding of themselves can do this.
And it's not dangerous as far as you're concerned. We did nothing scary or painful.
No, never felt any twinges, never felt anything that was uncomfortable. The only thing I felt was that when the pieces move correct, you feel a little pop and it goes back in, and the pain, you get a warming sensation, a slight tingle, and then it warms up and it kind of fades away, and the pain just goes away. It's like it just escapes through the back of your neck.
Great. Thank you very much.